This is the voice of Dr. Tolulope Olabintan of Livingspring Family Medical Center. Today we're talking about sleep, the why and the how, because it's very, very important. And I'm so excited to be bringing on our guest, Dr. Funke Afolabi Brown. Hi, I'm Cassie. Thanks for joining. Oh, look, there you are. Hi.
It worked. I'm telling you, that is a win right there.
Yes, it is. Good morning. Thank you so much for joining. You look nice. Love your backdrop. Dr. Una is watching. We have Cassie. We have
Hey.
Grace joining as well.
Yes, you do not get the stink eye, Dr. Una. You're good.
Yeah.
You get you get points.
So right before you joined, I was just talking about the topic, good sleep, the how and the why. Introduce myself, Dr. Olabintan, Livingspring Family Medical Center. And I usually like to introduce why we have these conversations, like why this topic. It is because our viewers, patients have asked, sleep. Hey, that's very, very important. There seems to be a big deal about it. Or there are talks around good sleep related to your health. And so there's a question of, well, how can I make my sleep better? So I'm so excited to have you here. I'm looking forward to what I'm going to learn as well, because this applies to every one of us. So without further ado, I'm going to hand it over to you and ask first to please kindly introduce yourself, who you are and what you do.
Thank you so much, Dr. Olabintan, for having me. So my name is Funke Afolabi Brown. I am a sleep medicine physician. I'm also a pediatric pulmonologist, and I am the founder of Restful Sleep MD, where we help families, especially busy moms, prioritize sleep in themselves and in their children for their optimum wellness. So I'm really excited about being here.
Thank you very much for coming. All right. So the next question is this, though. Why, I'm always curious. Why do you do why sleep? How did that come about?
I know it's interesting. So, from medical school, I've struggled like most of us, right, with sleep deprivation and burning the candle on both ends. And that just seemed to be what it was. And, I was one of those people that thought like, well, it is what it is. What are we going to do? But over time, I just realized how much lack of sleep was impacting my mental health, my wellness, my ability to learn. I didn't even know about wellness back then, right? It was more of just like being able to get those grades in, trying to study all night before a test to realize, oh my goodness, I can't remember anything I studied, right? So it was either trying to, bring things from, my long-term memory and things like that helped me. And so kind of got by for a bit. And then, by then I really started realizing, okay, I think sleep is pretty important. I was trying to prioritize it to the best I could, but it was hard.
Sure.
But fast forward, I went through medical school residency, and then I did a fellowship in pediatric pulmonology. And I just was so fascinated by children with, sleep breathing disorders who had issues with their sleep. And so many times, patients with asthma and things are coughing all night. Patients with reflux are coughing all night because they're uncomfortable, or they're up all night because they're not able to sleep, and their parents weren't able to sleep. And then I really started getting fascinated by some even much more rare diseases, like sleep disordered breathing in children with sickle cell. And so that really started to prompt my interest to get a sleep fellowship. And I went in really going in to learn a bit about sleep and learn how to help children who have breathing related problems. And then that just opened my eyes to just the science of sleep and sleep deprivation and its impact and insomnia and so many other sleep disorders. And knowing that now, it's like you've learned something, you can't unlearn it. So there's all the medical pieces, but now I realize, my goodness, this is really the missing link, I feel like, in people being able to thrive and excel and perform at their best, is if they're not sleeping well and you're really trying to run your tank on empty. Sleep can actually help and can help significantly. And that's really been my mission now, to help share the word.
Awesome. I like your mission, Doc. It's so interesting how we think we can get by with little or no sleep. But when we understand that we need to prioritize that, and that in the end would help us be more efficient at the things that we're, desperate or needing to do, I think it will help. And I'm glad that we're having this talk. So you mentioned the term insomnia. It's a word thrown around a lot. For the sake of our viewer, what is insomnia?
So we have the International Classification of Sleep Disorders manual, essentially, which is our quote unquote Bible for sleep medicine. And they have specific definition for insomnia. You're right. People use it kind of loosely. There's certain criteria that's met for you to diagnose someone with insomnia. And insomnia is difficulty falling asleep, staying asleep, or early morning awakening that's associated with daytime impairment, either for the person or for the caregiver. So now we're referring to a child versus the parent, and typically should have lasted about 3 months, and that's really those are the different criteria to be met for you to diagnose a person with insomnia. You do have what you call acute insomnia or sort of transient insomnia, which is somewhat within that category, but less than 3 months. Okay.
So you mentioned a few terms. One, inability to initiate sleep, stay asleep, and then wakefulness, feeling like you've gotten a good rest the morning after. And it affects not just you, but the people around you. Okay. Thank you for that definition. Now, this question I like to ask because there have been different ideologies on the number of hours. Like, how much is really enough? Like, how much really is enough sleep? Now, of course, I know it would differ from age, but let's just say children and then adults. Like, how much is enough sleep?
So the National Sleep Foundation has this whole chart about showing the recommended number of hours based on age. And like you said, it varies by age significantly, actually. So we're talking infants and newborns sleeping anywhere from 14 to 17 hours. School age children, school age children about 9 to 11 hours, and you have the preschoolers about 12 to 15 thereabout, and then but school age children about 9 to 11. Teenagers usually will say anywhere from 8 to 10 hours, and then in adults 7 to 9 hours of sleep. So I feel like you're right. There's so much out there. But the important thing is to figure out, are you in the 7 hours cohort? Are you in the 8 hours cohort? Are you in the 9 hours cohort? I think the bottom line is, how do you feel when you wake up, right? How do you feel so of course you want to try to be within those recommended hours, but do you need more or less? One, it depends on how you feel when you wake up. It depends on what your function is like during the day. Are you nodding off? Are you like steaming on coffee nonstop? Are you finding yourself like sort of veering off the road on your way back home? That might mean that's a sign that you probably are accumulating sleep debt, and so you may need more. So if you were doing 7 hours, you may need 7.5, things like that. So I think more importantly, while you try to stay within that window, the recommended window, is how are you feeling at the end of the day?
Okay,
those are things that matter.
I like that because you address the individual. So how are you feeling after? And you said 7 to 9. Some may need 7, some may need 8, some may need 9. It's a question of how you feel in the morning. But is there too much sleep? Like, if you know how you sleep like 10 hours and then you wake up even more tired? Like, why is that? I gotta ask why. I don't know. Is it that the body I don't know, it's too much and it gets too used to it? Is it good to stick to the 7 to 9 versus, overdoing it sometimes? What do you think?
I think, that you bring up a very good point. I think the entire world is chronically sleep deprived. And sometimes what is happening is when you're finding yourself needing up to 10 hours, it might be that you're just so chronically sleep deprived, you're playing catch up. Okay. I see that a lot with teenagers who are, first of all, their circadian rhythm is shifted. And so they're going to bed late because they have school, they have all kinds of things going on. And then they're waking up early for school. And then on the weekends, all of a sudden, they're sleeping 12 hours. So it's not necessarily that they're doing it constantly. Sometimes it's them just trying to pay off some of that sleep debt.
Okay.
That's one thing. Another thing that could be going on, apart from, I think the most common reason is that people are just sleep deprived and just trying to play catch up. Eventually you'll be okay and then you'll get back to your 7 to 9. This is and so the other reason is there might be an underlying disorder. There might be an underlying sleep disorder. So that's what I do, right? So apart from the fact that you're aiming for 7 to 9, you may get to that 7 to 9 and still need more. And it may be because the quality of your sleep is affected. And so I think those are some of the pieces that are at times missing. So if you have things like sleep apnea, or if you have, rare disorders like narcolepsy, for instance, where you're sleeping and you just cannot seem to get enough sleep, those may be things to consider, especially if it's like, okay, I've been doing this and I've been sleeping 10 hours or 11 hours or so for a very long time. You may want to check with your physician to make sure that there's no underlying disorder you're missing.
Thank you for highlighting a few points. And I want to highlight or reemphasize some of those for those who are watching. Your body would take what it owes, or what it's owed. Yeah. A lot of times, like, I'm used to it. I'm just going to keep going and going. Your body has a way of asking or demanding back what it's owed, and that includes sleep. So we have to be very careful. I also encourage dialogue with your physician, your primary care doctors, about the quality of your sleep. It is important. You may need to bring that up in conversation. Things like, she has said, doc, I sleep for 12 hours, but I wake up even feeling more tired, or I wake up, my mouth seems dry, or sometimes when I sleep, people say that I stop breathing or I snore really loudly. Could that be something wrong? So really, really important discussing sleep with your primary care doctors, and having that conversation that could lead to a referral to a sleep doctor. She mentioned sleep apnea. That's pretty much what I just talked about. That now apnea is your body not being able to, like, apnea is absence of breathing. You're sleeping, but you're not breathing when you sleep. So the quality of sleep is affected. And narcolepsy is pretty much where you're sleeping during the day, sleeping during the night. It's a disorder of sleep that needs medical attention to keep you awake when you need to be awake. So very, very important. Sleep is important. Discussions need to be had with your doctor. Thank you so much, Dr. Brown. I'm learning a lot already and trying to take notes. All right, my next question, especially, I know this is what people are asking or looking for. What can I do? What can we do to improve our quality of sleep?
So I would say, for me, when I look at sleep, I kind of focus on 3 things. Okay, the quantity of sleep, which we hear about a lot, right? It's those 7 to 9 hours or whatever that goal is. And then the quality of your sleep, and also what I call the continuity. So when you talk about the quality, are there things that are going on that's making your sleep fragmented so that you wake up and you just feel exhausted? 2 things can happen. One is more of some external factors. And then the other are, internal factors in that sense, like we talked about. If you have a sleep disorder, you want to improve, because no matter how much you follow a strict sleep hygiene, if you have a sleep disorder, that needs to be addressed, right? So we'll put that's taken care of. Now, in terms of just overall, how do we improve the quality? Some of the things we can do is consistency. I feel like that's something that I just can't get off my soapbox about, is the consistency, actually. The consistency of a bedtime and a wake up time. Because your body has a system called the circadian rhythm, which really sort of sets when you sleep, when you wake up, but it depends on some external cues. So when you wake up at a specific time every day, as much as possible, it helps to set that body clock such that you're able to fall asleep at an appropriate time at night. So in terms of that consistent sleep time and wake time, another piece is that you shouldn't shift too much on the weekends as well. So going to bed and waking up at maybe 5 a.m. or 6 a.m. on the weekday, and then trying to play catch up at 12 midnight till 12 noon, on the weekends, is really not good for your circadian rhythm. So that consistency, as much as possible, is important.
Wow.
So that's one.
I don't do that. I try to catch them. Okay.
Yeah, that's why we're here. That's why we're
Yes.
here. It's okay.
Thank you.
So, I mean, in terms of for the weekend, if you need like an extra 1 to 2 hours, that's fine. But you don't want to accumulate sleep debt. Like, we always say sleep is not like a bank. It's not like a bank. You don't like say, okay, I'm going to pay off my debt on the weekends. One, you don't completely pay it off. And two, it's just not good for your circadian rhythm overall. So if you do have to sleep in, maybe about 1 to 2 hours on the weekend. So that's consistency.
Okay.
Another thing that I would say that's really important, if I talk about maybe three main things, so the consistency is key. The other piece is technology. We all struggle with this. Technology is here to stay. Technology has advanced us so much here, and it's so beneficial, right? For connection, for networking, for business, for everything, right? But it does have its deleterious effects. And two ways it does is, and when I talk about technology, I mean, it's the cell phones, it's the TV, it's the iPad and video games and things like that being used around bedtime. And so when you're doing that, what happens is, remember we talked about that circadian rhythm? So your ability to fall asleep at night really is regulated by a hormone called melatonin, which is your sleep hormone. And so that sleep hormone kind of rises when there's dark. And so if your brain sees light, right, there's certain receptors that registers light. And because there's light, that melatonin production is suppressed. So having the light around bedtime, no matter what that kind of light is, whether it's, the light from, that's why we sleep in the dark, that kind of thing, or it's a light from your phone, that can affect it. The other piece that technology does is it creates just this increased arousal, right? That last email, that last text, that last group chat that then just sets you off. Then all those notifications, that kind of disrupts your sleep and can disrupt the quality of your sleep.
Man, you drop gems. I don't know. I'm like, yeah, we're gonna have to do a part two. This is, the light. I've had patients who say, I gotta have the TV on to go to sleep. And I say, and even the light, the processing from your brain that is processing all that data really quickly. Lights in milliseconds constantly. Like your brain is rapidly firing. How that's gonna help you sleep. I don't want to interrupt. Did you have any other tips for how to improve life before I go ahead and re-emphasize, because you dropped some gems that I don't want people, so I'm taking notes too.
No problem. So the last one I would say, well, there's a third one, and I'll give maybe one bonus. It's hard for me to stick to three. But these are better than like the 10 or 12 that you see online, and you're like, where do I even start, right?
Okay.
So I would say it's things like caffeine. So caffeine is a stimulant. It's the most popular drug on the market. And so it's caffeine. Yeah, it is. It is a stimulant. So yes, it is a drug. It's in coffee, it's in soda, it's in your iced tea. It's in energy drinks, right? Red Bull. Our teenagers are using that a lot just to keep going. And so we're in this vicious cycle, right? We're sleep deprived. We take caffeine because we just need to stay awake to function. But the problem is that the caffeine then disrupts our sleep quality. And so we're back there again.
Okay.
What caffeine does, it has a very long half-life. Okay. So its half-life is about 4 to 6 hours. So if you're drinking caffeine, or you're saying, okay, I'm taking maybe some iced tea, a glass of iced tea with dinner, it sounds awesome. Except if you take it at about 6 p.m., the half-life is 4 to 6 hours. That means at about 10 p.m., you're just about 50% done. So that caffeine is still in your system. And what it does to sleep is that it can affect how long it takes you to fall asleep, right? Because it's that stimulant.
Mm-hmm.
And then it also affects the quality of sleep you get. So you don't get into really, really deep sleep. as much. So usually what I would recommend is take it, if you're going to do caffeine, stop drinking caffeine like 1 p.m. Try to avoid drinking caffeine after 1 p.m. If you need to take a tiny power nap, that's fine. But the goal is to get enough sleep so you're not dependent on caffeine.
Awesome, awesome. This is beautiful. So you mentioned three powerful things, or three powerful ways that we can improve our quality of sleep. Number one, you said, is consistency, and that includes weekends. So as an adult, getting the 7 to 9 hours consistently. If you need to get an extra, maybe an hour or two, but not overdoing it. So your body gets its circadian rhythm, which is your sleep rhythm, in sync or balance and consistent and more predictable.
Yep.
So very, very, very important. Number two, your surround sounds when you're sleeping. Your special effects, very, very important. The TV, the cell phones, the iPad. And why? Because melatonin, which is a supplement some people use to help with sleep, it's released when there's darkness. Okay, when the brain sees light, those levels go down. So, and also the light increases arousal, and the messages can be stimulating, can be annoying, can be, can elicit emotions that can keep you up. So really, really, your surround sounds, that TV, cell phones, iPads, you keep them at bay when you're about to sleep. And the third thing you said is caffeine being the most popular drug that most people are not aware about, but actually acts as a stimulant. Now, of course, people are saying, of course, coffee has its benefits too. I'm not arguing against that, but she's suggesting that you stop by 1 p.m. because of the half-life. Half-life is pretty much how long it takes half of what you've taken to go away or dissipate from your body. So if the half-life is 4 to 6 hours, it means in 4 hours, half of what you've used is still in the system. So if you plan to sleep at 10 and you had some iced tea, which has caffeine, for dinner, then you're setting yourself up a little bit for failure when it comes to sleep. And you did mention power naps, the power of power naps every so often, and it's so amazing how they actually help. 15 minutes here, 20 minutes help here. You feel even more rejuvenated. So she's not saying power naps are bad. She's saying that's something you could do for the catch up. This is awesome. I'm looking at time. We have a few more minutes. Now I have a question. Someone asked this question. I go to sleep, and then I wake up like 4 hours later and I can't go back to sleep. So I say, well, since I'm up, I might as well, do this and do that. What do you think, Doc? What do you think about it?
Yeah, so that happens a lot. It happens to a lot of women too. I see that a lot. I think there are different reasons. Again, is there a medical reason? If you have anything, restless leg syndrome, where your legs are just uncomfortable, or sleep apnea, where you just kind of wake up because you're having a hard time breathing, that could happen. So that's one bucket. One thing that I notice that happens when people do wake up and are unable to sleep is sometimes it's anxiety or worry or anticipation of what they need to do. And so if your mind is kind of spiraling and running, and then you kind of wake up, actually waking up at night is normal. Everybody wakes up. Everybody wakes up about 5 times a night because we cycle through different stages of sleep. So waking up itself is not the problem. You usually don't remember you're waking up. You just go right back to sleep and everything's okay. But if you wake up and then a thought or something comes up that then just makes you fully awake, sometimes it's hard to go back to sleep. Now, what you should do is, sometimes you may be able to fall back to sleep, but that's all well and good. But if you're noticing that you're starting to have this sort of mind racing, pervasive thoughts, you're stressed out, oh my goodness, the day is going to start, it's going to be an awful day, I don't know what to do, oh my goodness, all the things I need to do. And then you start thinking about the laundry, all kind of random thoughts, right? Intrude our minds at night time. The best thing to do is just be done. Just get out of bed. Don't fight it anymore, because you're just there tossing and turning, right? It becomes this place of frustration. The bed is supposed to be a place of sleep, right? It's supposed to be for sleep, not for worry, not for stress and anxiety. So get out of bed and do something boring for a few minutes. Boring. That's the emphasis. Most of the time it's like, oh my goodness, I'm awake. I might as well get started on my day, that's not going to help you. That's not going to give you the incentive to go back to sleep. But if you pick a boring activity and you find out what's boring for you, for me, for some people, it's, folding and something super monotonous, folding and unfolding socks.
Ironing.
Or you said what? Ironing?
No, the ironing. I hate ironing. Oh my gosh.
Well, don't pick something that will frustrate you then, because you'll get a negative emotion, right? So you have to be careful. Or it could be like journaling. It could be, especially if you feel like it's so much thinking or so many thoughts that are intruding. Sometimes journaling would work. As long as you just get out of bed, sit somewhere else, whether it's the floor or a chair, dim light conditions, either journal, meditate, do something boring, read a boring book. Don't read some kind of exciting mystery book that keeps you up. And no matter what you do, avoid going onto your phone to start checking in on those emails or social media or things like that. So really finding the activity that bores you back to sleep. And once you start feeling sleepy again, just get back into bed and sleep. It may be hard, but don't try to sleep in too long. So even if you've had the roughest night, so remember, you want to really set your circadian rhythm. You want to cue it for sleep for the next night. So don't try to now say, okay, I'm now going to sleep in. And typically I wake up at 6 a.m. I'm now going to sleep in till like 10 or 11 because I had a rough night. You'll get through that day. Just try to get into bed the right time.
Awesome. You heard the doc. So she said boring. I don't think there's anything boring on your phone. Now, let me look at a TikTok video. No, not that kind of. Said bore yourself back to sleep. Bore yourself back to sleep. So journaling, meditating, books, but be careful about the book choice, not the stimulating book. And then you get out of bed, because we are trying not to make the bed a place of discomfort, of irritation. So step out of that to a dim area, maybe sit on the floor, sit in a chair, and do a boring activity. And then if you're able to get back to sleep, then you do that. Thank you. This is very, very, very good. I'm looking at the time.
Yeah, I know. I just want to add something though. If you're doing this and you're realizing you're having this problem for a while, then you might have insomnia. You might have chronic insomnia. So that would be something to, again, discuss with your physician.
Okay. Very, very good. Now, all of this, of course, as we know, is individualized. So really important to have this discussion, sleep discussions with your doctor, quality of sleep. What are things that you're doing that's affecting that? Are you stopping to breathe when you sleep? Do your legs bother you when you sleep? So I'm glad we're having this talk to raise awareness of the importance of sleep. A lot of times we think sleep is something that can wait, or we'll do that later. But it's really, really important and tied to the quality and actually the quantity of life. So sleep is really, really important. So Dr. Brown, I just want to give a shout out to you. This is good. I know we had other questions to discuss. We are going to do a part 2. For watching live and watching a replay, please send questions in. I'll collate them, and the next time we schedule a talk, I'll be able to ask those questions again. But for those who are watching, who are saying this doc is amazing, I love her glasses, her smile, and I'd like to reach out to her to see how she can help me, or I'd like her to come on and speak on this topic, because it's very, very important, critical to our healthcare. Where can we find you?
Thank you so much. So my website is restfulsleepmd.com. So that's a good place to connect with me. And actually, if you sign up for our newsletter, I do have, like I said, there's tons of information out there about how to improve your sleep. So I have an acronym that can actually help you start to create healthy sleep habits. I feel like that's a good place to start, and then move up from there. So that's somewhere you can find a lot of information. There's blogs, and also a link to my YouTube channel as well on there. I'm also on Instagram as Restful Sleep MD, and on Facebook as well, but I'm more active on Instagram. I mean, it was just like a huge success being able to make it to this life without getting lost.
The next one we'll do it on Instagram. That's right.
Oh, perfect. Let's go there. That's my home.
Yes, yes. So what I'm going
Yeah,
to do after this live, I'm going to put
yeah,
share the video, share the link, and I'm
yeah,
also put all your social media handles as well as your
yeah,
website information so people know where to find you. Thank you
yeah.
so much for coming. I'm honored. I look forward to seeing you soon. For those who
Yes, me
don't
too.
but we're done. Thank you all for watching. Please share this with those who you know would benefit from this, adults and kids alike. And if you or anyone you know is looking for a thorough, a caring, a passionate family physician in the Mansfield, Texas area, I am she. Thank you, guys. Thank you. Thank you, Dr. Brown.